Yes. How are you?
Yeah, I'm sorry about my doing this.
You're fine.
I get really nervous whenever I get back to that thing. It's like, oh, I didn't tell me what happened. And I just realized it's a nervous. I do. This is on, or is it next to my, it is on. Live stream coming on.
Will you put a trash can? I always use the trash can next to me over. Thank you.
Is that a very specific mask?
It is.
Nice, you too.
Okay.
Oh my God, that's amazing. We're not starting just yet, we're just gonna make the microphone on.
Will I do that?
Yes, please, just everybody be on good behavior. For your own sake.
We'll try.
Good morning. With the number of COVID cases at the highest level since the pandemic began, demand for COVID tests is understandably high. At-home tests have proven tough to find, and lines have been long at many of the drive-thru sites across the country. Last week, the Department of Public Health added a new testing location at the North County Recreation Complex to increase capacity, and those appointments have been filling quickly. Between the new site and our 3 permanent health clinics in Berkeley, Pine Lawn, and Sunset Hills, we can schedule 3,925 appointments a week, and all of those appointments were taken last week. At the North County Recreation Complex, our goal was 200 tests per day, and we're meeting that and hope to be able to add more at that location. The Health Department continues to look at how it increase capacity with a limited number of employees. One way is to tap community partners. By Monday, 2 branches of the St. Louis County Library will begin handing out COVID test kits provided by the Health Department. Residents will be able to pick up a test kit at either the Rock Road or Rebel Road branch, take it home, provide a saliva sample, and return the kit to any of our DPH centers. You can do that through the COVID testing drive-thru lanes, so you don't have to leave your vehicle, and no appointment is necessary to return the test. Results will be available within 24 to 72 hours. We're still working out the details of the take-home test program with the library, and we hope to have more information to provide you within the next day or so, including the number of tests available each day, the hours they can be picked up. But please don't go to the library today asking for a test. Both the library and the Department of Public Health will put out information on the program through press releases and social media, and we'll have it on our COVID website, revivestl.com. We continue looking at ways to supplement the supply of tests available to the community. The Health Department continues its work to provide for those who are uninsured and underinsured, who don't have access to a primary care physician. However, the Health Department doesn't turn away anyone. Pharmacies, health systems, and urgent care centers also provide testing, and now the federal government is taking online orders for free at-home tests. You can order up to 4 tests for home use at www.covidtests.gov. The demand for these tests will continue to be high as COVID cases continue to stress our hospitals, tax our schools, and challenge businesses to have enough staff to open each day. There are a few hopeful signs. Hospitalizations have gone down over the past few days, and so have reported cases in St. Louis County. But at nearly 2,000 new cases per day, we're nowhere close to seeing this virus stop its spread. With the Health Department's mask mandate and a steady rise in vaccinations, we do see these preventing measures paying off. The St. Louis County Health Department continues to have the highest resident vaccination rate in the state at 60%. But that leaves too many of our residents unprotected by the virus and at higher risk of getting seriously ill and passing on the virus to others. If this affects one of us, it affects us all. Our health systems are begging us to keep wearing masks, to get vaccinated, and to get boosted. Hospitals are experiencing the same staffing shortage that other businesses are, making it harder to care for those coming in with COVID and other illnesses and injuries. We must do whatever we can to help our healthcare workers and for the benefit of all of those who need treatment. That means vaccines, wearing masks, working from home if possible, and steering clear of large crowds. If everyone uses all the tools we have to fight this, we'll get through this much faster. Thank you, and I'd be glad to answer any questions.
Do you have any guidance coming from the federal government about mask distributions? We know that Biden's supposed to be addressing giving out those N95 masks at places like pharmacies and health departments. Are you all going to be handing those out, and if so, when and how?
Yeah, we are aware of the mask distribution program. We heard late yesterday, that the federal government will be making N95 masks available. We're waiting on more details about that program, whether they'll be mailed to individual homes like the testing kits, or there'll be a distribution plan through governments. We'll know more about that by today, I'm sure, in the coming days, and we'll share that information with you when we have it.
Are there any new efforts underway to try to boost vaccination rates? I mean, at this point in the pandemic, the county has put out, kind of public information, health clinics. What else can be done to try to improve that?
We're continuing our outreach program, especially in vulnerable communities, to get vaccination rates up through our community partners, through churches, through other third-party validators, other folks with relationships It's been tough in our community, and it's been tough across the country to battle misinformation and vaccine resistance. We've done better in St. Louis County than the rest of the state, but we know we still have a ways to go. We'll continue all of our programming. We'll continue those outreach efforts, and we'll continue to make vaccines available through doctors' offices, through pharmacies, and through our health department.
I'm going to jump topics just really, really quickly. I know that there's a Board of Police Commissioners meeting tomorrow that's happening. Can you give us any insight as to what's happening? Are you all going to be announcing a new chief possibly? What do you know at this point?
Question about the police department. The Board of Police Commissioners meeting tomorrow, and I know there's an agenda published, but I don't know exactly what they plan to announce. I don't expect any announcements, but I'd have to refer you to the Police Commission.
I jumped to the question about the budget. The county council is starting to revisit some of the new spending program requests. They seem to have questions about increasing the number of attorneys for the county councilor's office and then giving the health department more money for some new programs. Are you concerned that those wouldn't pass? Can you talk about those programs? Are they critical in your view?
Yeah, so the question is about cuts that were made to the budget by the county council in December, and we're in the process of restoring some of those cuts. We are representing the information to the council that was presented in the normal budget process, and that started this week, and then they will begin to consider restoring some of those cuts. Those are important programs to run the county, road maintenance, some expanded health services in the health department, expanded services in the county councilor's department, especially dealing with problem properties. We're especially interested in those programs. But I expect, as the county council continues to review that information again, that those budgets, those programs will be restored, and we'll get on with the regular business of county government.
What would you say to some of their concerns about funding these new programs past the expiration of ARPA funds, once those federal dollars run out, being able to maintain those services beyond that?
Well, there's some services that are grant funded, some services that will be funded through ARPA, and as those ARPA funds expire, then we'll make a decision on whether funding those services needs to continue based on our review, the productivity and the efficiency of those services, and whatever else is going on in county government. As we become more efficient, streamline county government, and implement the recommendations of our outside consulting group about how to make government more efficient and more effective, I expect we'll find the funds to continue the programs that are important to county residents that are providing services that they need, and we'll make those decisions when the time comes.
Anybody else?
I guess I'd ask one other question about
Sure.
the RAM settlement, at what stage the negotiations are, and if there's any update you can provide.
Question about the RAM settlement and negotiations. You know, we're having those conversations. There's no rush. The money is in a trust, and right now both of our governments are busy responding to the COVID crisis, and that's where our resources are directing. We've had some initial preliminary discussions, but there's no update there.
Thanks, everyone.
Okay, thank you.